Hi, I'm Caroline Smith.
And I'm Kaya Garcia, and this is prenatal screening, or also known as prenatal testing, and how to detect the Down syndrome chromosome through the screening.
Prenatal genetic testing can identify whether your baby is more or less likely to have certain birth defects, many of which are genetic disorders. These tests measure levels of four substances in your blood, therefore indicating your risk of having a baby who has a chromosomal condition, such as Down syndrome. Prenatal testing is used by 1/3 of the pregnant women in the world. This process is usually done within the first or second trimester of pregnancy. The results from the test can help make the best healthcare decisions before your child is born.
Detecting Down syndrome. Down syndrome is a genetic disorder caused when abnormal cell division results in extra genetic material from chromosome 21. Prenatal tests can determine whether a fetus has Down syndrome with nearly 100% accuracy. However, because these tests require using a needle to obtain a sample from within the uterus, they carry a small risk of miscarriage and other complications.
One tool used to conduct the biotechnology method of prenatal sensing is chorionic villus sampling. This process is typically done within the first trimester of pregnancy. This is after 10 to 14 weeks of gestation. A small biopsy of the placenta is taken for genetic testing by a small needle through a tube. This technique is used to detect any condition that involves chromosomal abnormalities. This process is more risky than amniocentesis.
Amniocentesis. Second trimester after 15 weeks is normally when this is done. The needle is inserted into the amniotic sac surrounding the fetus, also used to detect chromosomal abnormalities.
The prenatal detection of chromosome abnormalities has been offered for more than 40 years. Starting in 1950, the initial screening for birth defects was developed with ultrasound. This process then advanced into amniocentesis in 1970s, followed by chorionic villus sampling in the early 1980s.
The economic impact of prenatal testing. As the technology advances and more prenatal care is offered, it boosts the economy. The Purgenologist Labor and Delivery Unit has grown from 60 deliveries a month from 10 years ago to about 290 deliveries per day.
Prenatal testing has had many social impacts on the society. Many ethical concerns have been raised based off of the use and effects of genetic information in the non-clinical conflicts. This constitutes a risk of genetic testing. Prenatal testing also requires ethical alliances based on careful understanding of how social attitudes and non-clinical uses affect voluntariness and potential harm and benefits of testing. This development of science also reduced the incidence of aneuploidy, which is Down syndrome, born to mothers. Many women also decline prenatal screening because they are against abortion.
The scientific impact of prenatal testing. Prenatal testing allows for pregnant patients to determine and identify the future of their fetus. This advancement in scientific technology has overall advanced the biotech behind ultrasound and prenatal testing. This was a significant advancement. Before these prenatal tests existed, the, dedi- the, the detection was done through ultrasounds and blood draws over multiple visits.
In the United States, pro life advocacy groups have been making their way into limiting women's access to abortion care. With the new advancement of prenatal care, it offers increased genetic information available to women early during their pregnancy, therefore decreasing the wanting of abortion care.
The future of prenatal screening. In just over a decade, prenatal screening has gone from a laboratory experiment to an industry that serves more than a third of pregnant women in America. In the future, prenatal screening is projected to advance highly. This development could result in a lot more women being able to prepare for the future of their fetuses.